It's Children's Dental Health Awareness Month. Orthodontist Karen Guinn with the Smile Agency joins us to answer all of your questions about keeping your kids' teeth healthy and your gums healthy. Thanks for being here, Karen.
Yeah, nice to see you.
So I'm just curious, you know, they keep talking about, I'm not very good about going to the dentist as much as I should, but is the twice yearly dental visit really necessary?
Oh, it's very necessary. We'd like to see everyone just come twice a year to the doctor and get a good checkup, and kids especially start at age 3.
Age 3, because sometimes they recommend 1. I took my kid at 1, and he like barely his one little tooth.
Yeah, my son didn't have teeth till he was 18 months old.
Yeah.
Right. So about
about 3, you bring him in.
3, bring them in, get a nice cleaning, and then we'd like to at age 7, that's the ADA recommended age to go get an orthodontic exam to see how your teeth are doing.
At 7, wow.
And
whether you're having problems or not?
Yeah, just to make sure there's nothing really wrong, make sure the teeth are coming in correctly, make sure the alignment and things are set up to keep going and have a good smile.
Now, you wouldn't start treatment that early. Why do you need to be seen that early?
Oh, there are a lot of times you need to start treatment that early.
At 7 for orthodontia?
Oh yeah, even earlier, even sometimes at 5, depending on if there are bone issues or the teeth don't match up correctly. So a lot of times we start with the phase 1, and that's where we do a partial set of braces to actually correct the alignment of the teeth. And it does life-changing things where later on you can save a child from having jaw surgeries, their self-esteem.
Some kids have, you know, really bad overbites. I know my sister sucked her thumb for a long time.
Yeah, that's very damaging. But it can be corrected early. So if
is it better to do it early versus, you know, waiting until everything's formed and in its right place kind of thing?
Yeah, the technology these days is so incredible that early changes are permanent changes. So you can really make a lot of changes with their jaws, their facial changes, and it's a life changer.
Because then they can feel confident about smiling and you know, being happy and things like that versus, oh, I'm not going to smile, I'm not going to let you see my teeth.
You'd be surprised what a smile can do.
You would be, wouldn't it?
We really would. It's just an awesome thing.
But how do you get them to not feel like that with the braces on? Because it's kind of a switch off. You feel like this as a child, but then as an adult,
believe it or not, they want them.
I did. I used to do the paper clip thing.
They come in and it's like a thing.
That's why you did your own orthodontia.
So I'm loving it. So I mean, and you know, it's a good thing. I see adults, I see kids. So it's from like 7 to 70. It's never too late.
Now, I wanted to ask you quickly because I saw on, you know, you had some of your like top signs of when you should get to the dentist. And I heard when you're pregnant, you're supposed to go to the dentist. Why is that? Is it for the baby or?
Well, no, because of the hormones going on, your gums are more prone to have bacteria. So most pregnant women have inflamed gums, so it's more.
I've had one cavity in my life, got it when I was pregnant.
Really? I didn't even know.
So it's better to just go and get your teeth cleaned a little more often, keep the bacteria down.
Get it all clean.
And I highly recommend everyone use hydrogen peroxide instead of toothpaste because it kills the bacteria.
Instead of, so you pour it on your
and brush.
Wow.
Okay, well, that's a great tip. And
good tip. Thank you.
I know there's apps out there too that they can check out. But thank you, Dr. Guinn, for coming out and telling us some of these tricks.
Awesome.
All right.
Yeah, hydrogen peroxide.
Well, you might be smarter than Einstein was during his teenage years.
Well, that's what actors of the Sierra Madre play Einstein is a Dummy will try to convince us of next.
I could be